Hey YouTubers! So today's plan is to literally go over the mandibular division of the trigeminal nerve within 3 minutes, and it's a quick overview, okay? So what we're going to look at first of all is where it emerges from. We've got the foramen ovale, okay? It comes out and it divides into two. It divides into two branches, main branches, the anterior division and the posterior division, as you can see here. The posterior division and the anterior division. The anterior division is mainly motor. The posterior division is mainly sensory. So wait, how are you going to remember that? Mainly motor. The MM, and it innervates the muscles of mastication with the MM, okay? There is but one exception. So the B for buccal and but. So there's an exception. The long buccal nerve is sensory, okay? So that's the anterior division done. So moving on to the posterior division, which is mainly sensory. So you'll have to just remember that as a fact. The posterior division is mainly sensory, and that's it. Okay? You have the nerves, the lingual, the auriculotemporal nerve, the inferior alveolar nerve, and then 3 are all sensory, okay? Just to orient you a little bit more, when the inferior alveolar nerve leaves the mental foramen, it becomes the mental nerve, okay? And again, it's still sensory. Got it? So mainly sensory is the posterior branch, but with one exception. Do you remember the M rule? Nerve to mylohyoid, which is motor. So just to reiterate again, the posterior division is mainly sensory, except the nerve to mylohyoid, okay? So there we have it. Quick diagram to summarize. So a quick question for you, if you were to cover one of the answers to the question I want to ask you. Actually, let's cover it all. From memory, what do you remember the posterior division is? Mainly sensory or mainly motor? Give yourself a second. Or maybe 5. You don't even remember that long. But there you go. 5, 4, 3, 2, 1. Good.